The United Nations Development Program, along with other UN agencies, have put their effort together to support the contingency plan that the government itself has formulated in order to fight the COVID-19 pandemic. And as I said several times to several people, we did not wait until the pandemic to actually focus on that community development, and that's the reason why our mayors were here today. But we know that it's important, essential for us to help not only sensitize the populations, but also provide them with the PPE equipment that they wouldn't otherwise be able to afford. And that is the central piece to combat the pandemic, but the overall development plan is to help the communities develop themselves instead of focusing on central development. What we have done in terms of supporting the communities in the context of the pandemic is to provide them with PPEs, protective personal equipment, to help them help the communities to combat the pandemic. And that is here the provision of a number of PPEs, including masks, hydroalcoolic gels, protective gowns, thermo flash, soap, etc. But that's not it. What we really believe in is helping small businesses in those communities, mostly women and youth owned, to be resilient, because we know the impact of the pandemic on the economic activity. So what we want is to help those businesses, small businesses, that really are not striving at all to be able to survive. Either help them in what they are already, in the area that they are already producing in, so that they are resilient, or reprogram and reorient them in another way of producing, or other productions, so that they are able to actually not only produce but also generate income. And that is what we are finalizing right now, a program document that would help them be resilient. Because as we know it, the informal sector shouldn't even be called the informal sector. It's the popular economy, because more than 60, sometimes 90% of our populations operate in that area. So we have to help them be resilient, otherwise life as it is never going to be normal. We need to ensure human development for the population that are the most vulnerable in those communities. And we are doing that.